Dr. Maureen Allen, founder of Skin Renewal, one of South Africa's leading medical aesthetic clinics, and CEO Victor Snyders, are here with me to tell us why you are never too young or too old to start taking care of your skin. Welcome, Dr. Maureen.
Thank you, Cindy.
Hello,
Thanks,
Victor.
Cindy.
Dr. Maureen, are you ever too young? And is it ever too late to start your skincare journey?
No, never. You're never too young and you're never too late to come for help if you see a problem. We live in South Africa where the UV ray is tremendously high. It's the second highest in the world. And, you know, we have a lot of sunburn and sun damage and sometimes severe sun damage. So you don't realize that by the time you're 20 to 50% of the skin damage is already done. And we need to rectify that. So, you know, normally I'd say from the age of 25, you really start having to look after your skin, but in South Africa you have to start earlier to get rid of that sun damage that you've been exposed to for the last, 25 years.
And Victor, do you think it's ever too late?
Not at all. So, interestingly enough, when Skin Renewal started back in 2005, we did a lot of analysis. The average age of our patients was nearly 40. In today's time, the average age has dropped into the low 30s. And that has only happened because a lot of people in their 20s are starting to come in. It's easier to prevent a wrinkle than it is to take it away once it has formed and it's deeply ingrained. So it's an investment.
And in Skin Renewal, we see that you talk also a lot about pre-juvenation.
Collagen banking, because all the previous sun damage has damaged your collagen and elastin. So by doing collagen stimulating treatments, you're actually banking collagen for further use. You're actually improving that sun damage, which we call solar elastosis. Down the line, you start getting this thick skin full of too much elastin. So that's what we do. It's all about, improving the sun damage that you've already had.
We see internationally treatments like bioremodeling. There's a very big uptake in those treatments. There's also initially a subtle treatment. Do you also do that? Is there a big uptake in South Africa on that?
No, absolutely. It's one of our most sought after treatments. So we've been doing PRP for many years, where we draw your blood, we spin it down, and then we take the plasma and re-inject it into your skin, or we use microneedling to actually, gently apply to your skin. It's incredible what it does. But now the last year, we've been doing the PRF, which is the bigger sister to PRP. So what that does, we don't put any anticoagulant in, and it actually forms a fibrin mesh that stimulates growth factors and stem cells for the next 10 to 14 days. Whereas PRP, you have a quick flash of growth factors and stem cells for 10 to 12 hours. So it's quite incredible what the PRF does.
And is that for all different skin types, Victor?
Absolutely.
Absolutely, men and women. Not being the doctor, I tend to speak in analogies which I find more understandable from my background. And it's very much like a car. If the very first time you send your car for a service is when it's 10 years old and you've done 300,000 kilometers, well, you'll be lucky to have got that far in the first place. However, if you regularly service, then your car lasts. Unfortunately, when we're born, we don't get a service manual and a guarantee issued. And we have to take on that responsibility ourselves of doing regular maintenance.
So, Dr. Maureen, how often should we be coming for PRP, PRF?
Look, if you do a PRP or PRF, you have to have 2 or 3 treatments, and then it's just maintenance. Maybe every 6 months if you're older. If you're younger, you can do it once a year, because everything needs maintenance.
What is your #1 rejuvenation treatment that you're recommending at the moment, if you can only choose one?
It depends. For pigmentation, it would be our Pico laser, because that, takes out that deep dermal pigment. And then the next one would be our laser genesis. That's our workhorse in the branches and the clinics, because it's non-ablative and it does fine lines, texture, redness. And then we have the radio frequency, the skin tightening, especially now with, women and men losing so much weight. And, they lose the 10 kilos, they feel fabulous, but really, it's quite scary. They look 10 years older because of the sagging that occurs. So for every 4 kilos of weight that you lose, which takes you about a month, you need to do some form of skin tightening treatment, whether you do biorevitalization or whether you do skin tightening, just to keep that, that gravity in check.
Okay, well, it sounds to me like we need all of these treatments. We need to skip social life so we can go for treatments. Thank you very much.
Only once a month, yeah, so.
And maintenance. Thank you, Dr. Maureen.
Thank you,
Victor.